Good evening and welcome. Thank you so much for being here. I'm Commissioner Sonia Fisher, and this is a very exciting night. As I was looking at this, is this not just gorgeous, everybody? Yes. As I was looking at this and celebrating from my own perspective this milestone that we're experiencing, I just thought about my experience coming on the Clackamas County Commission and having the wonderful opportunity of participating in one of the road shows. How many here participated in? Okay, so we have some folks. Excellent. Thank you. So what the road shows meant to me as a new commissioner was an opportunity to gather around issues and concerns that we all really care about. And it was more than looking at concerns and putting dots on a wall. It was connecting, communicating, and discussing what is important for our community. And I know in the group that I participated with our Equity, Diversity, and Inclusion Council, we discussed obesity, we discussed access to health care, we discussed affordable housing, we discussed kids, the importance of our youth, graduation rates. We really had conversations, we connected. And when we look at what it means to create change and to have an impact, it's building community. And this process, a blueprint for a healthy Clackamas County, is all about building that community so that create the foundation so that we can create healthy outcomes for the residents that live here. So I know that you're going to go through all of this, but I just got to say that the piece that was very celebratory to me was on page 40. I got to put my glasses on. Page 48, when it looks at all the community stakeholders. And I know that many of you are here tonight, and so I want to say thank you so much for your participation. This is so very important, and I want to thank you for this. This is the policy, as the policy wonks call it, this is the policy framework. These are the values, these are the priorities. It's all in this document. You're going to go through it and hear all about it, and then there'll be the opportunity to do the how. And the how is where kind of the rubber meets the road, and it's where we really get to work and make it happen. And this is where it is, in a room like this with all of you that I know care so much about our community, care so much about the residents that live here, and care so much about the future of our children, our grandchildren, and sustaining the beautiful place and people that we have. So thank you for being here. So appreciated. And because I was not looking at my talking points, I forgot to introduce our Health, Housing, and Human Services Director, Richard Swift.
All right, that's nice. Thank you. I'm afraid to put this on the keyboard because I'm afraid I'll hit a button and then change up the presentation. So my name is Richard Swift. I'm the Director of Health, Housing, and Human Services, and I want to thank everyone for coming here. Also want to thank Providence for making this facility available to us, and also want to thank Kaiser for the food and refreshments, so thank you. And also I want to thank Scott Anderson for the talking points that he prepared for me that he knows I won't use. So to reflect what Commissioner Fisher talked about, I'm really, really excited about this process just because the community health improvement process, the plan, is something that we're doing differently this year. So this is the second time in my 6-year career with Clackamas County that we are doing this. And we have completely reoriented our approach on this. I want to thank Dawn and her staff related to the road shows that they put out, all of the effort and time and intention that they took to roll this out for Clackamas County. Coming from Florida, she made a huge transition, making that trip, taking this on, learning how to work with me, which is no big, easy venture. And, but this has been such a successful process. And what we are going to have for our county is a much stronger health improvement plan than I think we have ever had before. And the thing about this is the following year, it will be that much stronger. The next one we do in 3 years will be that much stronger. And, you know, about public health, public health touches all aspects of our county. They touch water, they touch food, they touch immunization, they touch every resident in this county. And it's public health, actually, that is really pretty much responsible for, if you go back to the late 19th century, early 20th century, for essentially the health of this country. Immunization, water, and sanitation. Without those three things, society collapses. You know, you can take the water away from a jurisdiction for 3 days, they're done. I mean, you know, to be more somber, we can look at what's happening in Puerto Rico and the collapse of the power grid and what it means for that island in terms of all of the residents that reside there. And I think, you know, just to take a moment, you know, actually, if you can, get on Facebook, whatever kind of pressure you can. You know, the United States has not really stepped up for that island and the residents, and they are part of the United States. And so I think it's important for us to not forget that. I mean, I think we're actually related to that, and this is something that I didn't even know I was going to say until right now, that, you know, we are kind of seeing, I think, a repeat of something I thought the country had learned from, which was Katrina. And so, and there what you see is they're hanging on relative to their public health by their fingernails. And I'm very worried that it is going to get worse. And so, you know, what we have here is, I think that'll be part of also our approach related to our process with this blueprint, is we will be actually looking at emergency response. That will be part of our conversation as it relates to this process. So I really do appreciate everyone showing up for this event. This is really important, and please know that this is actually the kickoff for what is a 3-year process. So we're building the health of this county, and I'm really excited. So I think I'm supposed to bring up Dawn here now, and yep. All right, thank you.
Well, before I start going through these slides, I really wanted to take the opportunity to acknowledge really the people that have done all of the work. And so for every member of public health staff, please stand up, please. Yes. You guys are the superstars. I also want to acknowledge our Public Health Advisory Committee members that are here as well, so if you could please stand up and be recognized. Thank you. Thank you very much. So I just have 3 things that I just want to kind of mention. On the agenda, it's talking about, you know, the future is bright. So I really want to have 3 concepts that I want to either remind you of, or maybe this is the first time that you've heard it. So the biggest catalyst for all of public health work in Oregon, and here specifically in Clackamas, is this thing called public health modernization. If you have not heard about it, I don't know where you've been. But this is really the driver. Everything changed when House Bill 3100 was passed a few years ago. 3 years? 4 years? Okay, before I got here. So public health modernization is really the driver. It is the policy or the law that took 1978 state statutes, public health state statutes, and flipped them on their head. And so by 2023, all of public health departments in the state of Oregon have to modernize their system. And this is what modernization looks like. And so we've been really working hard to really innovate and modernize the way that we do work. And I think the chip, or your blueprint that you're here for tonight, is a really great example of how we're going to be needing to do things differently. The other thing that I think is really awesome, and you're going to see a lot of this when you break out into your work groups, is this idea of these health equity zones. So we know that Clackamas is really different across the county. We have wealth, we have poverty, we have high education, we have low education, rural, urban. And so it's really important that public health does not take a one-size-fits-all approach to the work that we do. And so we came up, a lot of cities are doing this, so this is not something that we made up, but we felt like we could lean into this model that's occurring in some of these other cities across the country. And so we divided the county into 10 health equity zones. We know that health or wealth equals health, health equals wealth. So the more wealth you have in a community, the better outcomes. Where you have poverty, the studies show that you're going to have poorer health outcomes. So I want to just ask you, you might have heard me say this before, but there are county health rankings that come out every year by the Robert Wood Johnson. And so it ranks all the counties in the state of Oregon and all the states across the country. So where do you think Clackamas ranks on a scale of 1 through 34? Do I have that right? 36 counties. Where is Clackamas? If my public health staff answer this, I'm not. So where do you think Clackamas ranks? 34?
Second.
Fourth.
Fourth.
Second.
They don't count.
No!
Oh, you said it. Yes, you count. Second. Yes, they're second. So one of the reasons why Clackamas is the second healthiest county in the entire state. Who do you think is number one? Washington. Washington's number one. They're the healthiest county in the state. And Clackamas is 2. But if you were to take away the West Linn and the Lake Oswego and probably maybe parts of North Clackamas, you would have a completely different county. And this is the reason why we demonstrated the health equity zones in the way that we do our work. And so this is a really great accomplishment, and you'll see a lot more later on today or tonight. So here's an example, not to freak you out, but this is an example of why health equity zones are really, really great for the county. So this is chlamydia rates. It's such a great topic, isn't it? But it's public health. So chlamydia rates broken down in the health equity zones, and you can see where there's a little bit of a problem in one of them. And so being able to take this data and really drilling down into different parts of the county allow us to do different approaches and be equitable. So we can see that Gladstone is having a little bit of a tick up. If we wanted to break that down even more, so we can because of the health equity zones, we want to understand that a little bit more. And so we broke it down into age. So the percentage of chlamydia cases by age over the 4-year period, one of the highest growing age groups is under 18. So from a policy perspective, we know now that we can go back to maybe Gladstone. If under 18 is where we're seeing the highest amount of ST or chlamydia, then that's a great opportunity for us and for every single one of you in here to help us resolve that. And we wouldn't know that if we were just looking at county level data. So this is really important work. The last thing I wanted to share with you before we move on is the third big thing is we completely restructured our entire public health division to line up with modernization. Completely restructured it. And so I know you can't see this org chart and you're not really intended to. It's really just symbolic. But I can tell you out of the 36 counties in the state of Oregon, not one public health department except for Clackamas has positioned themselves ready for modernization. And that is something to be so proud of, that we're ready organizationally. And I just again want to thank everyone. Rich, thank you for supporting the restructuring, and everyone here, you are seeing something really, really spectacular happening in this county. So, without further ado, that is the future of public health. But now we have some additional exciting news.
Hi, I'm Keith Tomajan. I'm the CEO at United Way of the Columbia Willamette. First, we're so sorry that we can't be there tonight to join you at the launch event for this very important blueprint for a healthy Clackamas County. Our entire board and staff are tied up with the dedication of our new Center for Community Transformation. That said, we're incredibly proud to make an investment of $40,000 to match county funds already invested for the launch of this important blueprint. We particularly admire the work Clackamas County is doing to reduce poverty and improve health outcomes. What we're really thrilled about is the way the blueprint is built on solutions that come up and out of the community and commits to equitable access by focusing resources on the communities that are struggling with the worst health outcomes. At United Way, we're working hard to build a region where all kids and families can thrive, and we know you and the county are doing that as well. We look forward to working much more closely in the months and years ahead, and we're particularly proud to make this investment. Congratulations.
All right. Give me that clap.
So is anyone from United Way here?
No, that's
No?
why they sent the
Okay.
video.
Well, I guess I'll say, thank you. And on behalf, this is just absolutely outstanding in terms of, a little bit more gigantic cash for, this effort, which is definitely needed. So, this is awesome.
Yeah.
And so who in the finance division should I hand this to?
Take a picture with your phone and deposit.
Oh, you're right. I didn't even think about that, of course. You're right. Thank you, Mike. That's why you're here. That's why you're here. Perfect. Okay.
Or we can set it back up on the ledge. So just to be real clear, boy, we've held on to this news for a long time, and we really did not want anybody to learn about this. We just told staff just like a week ago. But the $140,000, let me just be real clear. The county commissioners, I will tell you, this did not happen in Florida at all. I mean, we did the community health improvement plan back there, but the local government never invested in it. It was, hey, great job. And when I came here and noticed that our county commissioners believed in this process so much that they allocated money for us to give back out into the community in small mini grants to help us advance our community health improvement plan. And so they give us $100,000 a year that we can put back out into the community to help us. And we've been doing that for several years. And so when we approached United Way, we asked, can you match this? Can you help us build this? Because $100,000, believe it or not, is not a whole lot of money. And so we want to be able to make good impact, not quantity, but quality. And by doing this, we hope that this is a challenge for everyone in this audience and those who are not here to maybe join us and to join United Way. And so we can make this 140 maybe into 250 and then 350, and then who knows what will happen. So I just can't say enough about United Way for taking the stand and being a part of Clackamas County. So thank you for that. So we're going to get ready to break out into our work groups, but I want to just kind of give you a little bit of some background and some context. So the logistics, so how did we get here? We started this process several months ago, and it really all kind of started, Clackamas County Public Health is an accredited public health entity, which is really wonderful. We were one of the first 50 in the country to be accredited back in 2014, so it's a real privilege to work here. With the accreditation, you must do a community needs assessment every 3 years, a community health improvement plan every 3 years, and then a strategic plan. And so this is why you're here, because we started the community health assessment with the Healthy Columbia-Willamette collaboration. So that's a big regional assessment that we do, and you can read more of that in the blueprint. It does go into a little bit more detail. And then we established the health equity zones, and then we did community roadshows. The indicators that you have in the assessment and as well as the blueprint that you have in your hands was driven by a framework from the Institute of Medicine. So it was really important for you to know that we didn't just kind of sit over there in Red Soil campus and say, oh, well, let's just look at this indicator and this indicator. The Institute of Medicine makes recommendations of indicators that are reflective of the health of your community. And so that is the framework that we used. Some folks will say, well, our indicators aren't in there. My cause is not in there. And that does not mean that it's not important. That's the reason why we do roadshows. That's the reason why we did public comment. That's the reason why you do focus groups, because you can't have all of the indicators, but you have to diversify the way that you collect the data so that you're not missing anyone. So, the community roadshows, and then we went into the improvement plan, like you said, what we've been talking about, public comment, and then the community strategies, and then that's what you have in your hand. So this is the process that we've been working on. So let me make sure. So let's talk about the groups. So you're going to see 3 breakout groups. In the blueprint, everything that you have there in the blueprint are the themes that came out of the assessment, as well as the goals. So we knew from the data the goals associated with 3 of these areas. So access to healthcare and human services is one theme, healthy behavior is the second theme, and then the culture of health. Culture of health is basically a fancy term for social determinants of health. Okay, so those are the 3 buckets. Those 3 buckets have goals associated with them, which you see in your blueprint. What's not in there, because public health didn't want to sit in the office and determine what was best, that's why you're here tonight. You're going to choose to sit in one of these 3 buckets or subcommittees, and you're going to work with us. We're going to facilitate the group. We're not going to tell you what to do. You're going to help us determine what are the appropriate strategies in the community to meet the goals that are listed in that blueprint. That's why you're here. But you're going to help us with the strategies. Because again, we don't want to be top down. We want the community to be from bottom up. And we love that. We love hearing from you. I thank you from the bottom of my heart and everyone else from Public Health for being here tonight. And we really look forward to working with you over the next several months.